Good afternoon, everyone. My name is Nazar from Section BS in Neurologic, and today I will be performing the neuromuscular system. And first is to identify the patient, which is the two identifiers, the name and the birthday. So, sir, can I ask your name and birthday? Thank you, sir. So next is explain the procedure to the patient. So this musculoskeletal system to ensure you if you have any abnormalities when it comes to assessing your overall health of the body. The next is perform an hygiene. Then lastly is assist the patient to address if needed. So let's move on to the neurovascular system. So first, inspect the patient's mental health status. So, sir, are you okay with it?
Sir,
Is your patient oriented?
So, sir, can I ask you where are you now the static exam?
so next is we're going to identify the level of consciousness of the patient. So since earlier we asked the patients about his or her name, then he responds to that is how we assess the level of consciousness.
Cheers. And the next is to access the memory. Can I ask what did you
Sir,
eat
can I ask what did you eat for dinner last night? And
during
where did
dinner?
you study in elementary?
Lunch.
Can I ask you, sir, can you recall your main task or right now?
Chicken, rice, and cell phone. Can you repeat that? Chicken, rice, you?
So next is assess the patient's
Abstract reasoning. Abstract reasoning.
assess the patient's abstract. Sir, can you see clearly? So, sir, do you have any problems to your eyes?
So next is we're going to assess if the patient is
Kasi yung tingog kaya natin chicks din.
next we're going to assess for the patient is
Manuan si Edeline.
what I do. So can you read? Okay. Then how about you? Can you raise your hand?
Expect
Next is place your hands, patient's shoulder and see if they can assist. So sir, can you show
Can you please hold your
one time?
Hindi ka lang dugos ka lagi, hindi sa kadungos.
So
Kasi
next,
kami.
tanong? Segundo.
Oh.
Okay.
so sir, first is place your
Sir, can you please
hand over your head.
here while
And then next is place
Ito na cranial nerve.
place one nostril to the patient, and then we have substance to identify if conduct
Shoulder shrug, shoulder shrug.
Oh, and then?
Cheek resistance.
Sunod. And then ito.
And then kay kanay,
Own words. Sige, your own words.
okay, then sir, can you, next is to ask the patient to move his or her head, neck as far as possible. So sir, can you please?
Oh, Lorente, buhat ha. Ha? Manaka? Oh. Ano si Tuan? Oh, sige, and then?
Ask the patient to identify what object I will be moving by closing her eyes.
Pas alin na yun? Sakto na yun.
Ask the patient to
So
close
can you
her
please
eyes.
close your eyes?
Hindi siya sa ito. Sorry ah. Paksa mo ang ito. Dugay, nagsamutin ko.
Ask the patient to close her eyes as I will give the object to the patient.
Kamu, perform. You don't need to say anything.
Please
Okay, Leah.
close your eyes and then
Close your eyes.
If she'll able to identify the object, this is a stereognosis. If she can identify what object it is, then it is a stereognosis.
Next.
Ikaw na.
Next is also we also do the same, the closing the eyes while the palm of the patient must exposed by also trace a number and to see if they can identify that kind of number.
So what do you call that procedure?
Perform.
So next is we're going to assist the patients for tendon reflex.
Deep
Deep,
tendon.
deep tendon reflex.
So in the chart of the patient, you will you start with
So you start with but you start first at the wrist look. Gently place your thumb to the wrist of the patient, then gently use the reflex hammer and grab the patient's wrist.
Ito mo siya. Ito anak. And then what nerve?
Corner.
The cubital area and top with a reflex hammer.
Ito sa kanang pan.
Dala.
What is the other name for that bunganoy?
Next is just move on to the triceps tendon by placing your hand and then tap it with a hammer.
Hammer. What type of hammer?
Reflex.
Reflex hammer. So you what nerve?
Number 7.
6 and 7.
6 and 7.
6 and 7.
Next.
So next is we're going to assess for tendon reflex in the patella by using a reflex hammer. So this belongs to from lumbar nerve, lumbar 2, 3, and 4.
Ano sa baby?
Is the active scan done. There's also
Oh, sa dika. Yung pa dika din. Okay, siya pa din. May
Next
person
is,
nagit na siya yung supa.
next is you have to tap the Achilles tendon with a reflex hammer.
Ay, kung gusto yun. Ay, kung gusto yung game. Sasayin siya na mo. Left and right ha. Next. Siya na.
next is next is the stroke of the patients using the reflex hammer.
Yung sa magito suka. Tao? Sad.
Masa nang kadlo ka na kulog. Gilog kayo. Ayaw, dapat jud.
Saan? Di.
Kato jud, dapat jud ka na.
Wakay pe. Ikaw lang si mong yawi.
Gilog.
Kalinis mong gusto.
Gilog ka.
Yeah, J. From J. Yan, tanawa niyo sa
Tanaw yung toes. Toes niya, tanaw yung toes. Inaana or naubos.
Oh, so niyon sa man. Ha?
Ito yun.
So, next is where to assess for reversing legs by simply asking the patient to lift and to straighten his or her feet with using examiner's opposite force.
Yan naman, pasyente
So, I
naman.
am performing force index.
Saka tila kan paubos na.
Yeah, next.
Next is assist the patient in a standing position. Then observe the patient as she walks with a regular gait.
Normal sa ha, normal. Then, yeah, normal sa na walking. And then, you let the patient perform what?
Toes.
Next. Ato?
Toes.
There.
Kinto.
Kalak pa sila.
Then boxer.
And then next, isa pa?
Heel.
O, heel.
Dapat may next, diba? From katong heel to toe mix na ako.
Ano ba?
Na test miss ba? Ado. Kanang ana ba? Mag-ana maglaka.
So next is after positioning the patient in a standing position, you must let the position straight on.
Ha? Wala gito. Ano?
Roomberg. Ikim magbantay niya.